Good day guys. In this video we'll study about the anatomy of the anterior abdominal wall. So whenever we hear the term wall, we must know that the wall has boundaries, right? So we'll study about the boundaries which comprises the anterior abdominal wall. So coming to the boundaries, so we know that this bone is the sternum. The sternum gets terminated as a cartilaginous process called the xiphoid process. So this is the xiphoid process. The first boundary is going to be the xiphoid process. The second boundary is we're speaking about. So this is the costal margin from 7 to 10. So the second boundary is going to be the costal margin from 7 to 10. And here you have the anterior superior iliac spine. So this is the anterior superior iliac spine, and here you have the pubic crest, and here you have the pubic tubercle, and here you have the pubic symphysis. So these are the bony boundaries which comprises the anterior abdominal wall. So as I told you, so here you have anterior superior iliac spine, right? And then you have pubic crest, and here you have the pubic tubercle, and you have the pubic symphysis. So now coming to the surface boundaries of the anterior abdominal wall, the surface, you have the umbilicus. You know umbilicus. So the surface boundaries are the umbilicus, and then you have a line, the white tendinous line called as the linea alba, which is nothing but the white tendinous line which runs from the xiphoid process. So there is a white tendinous line which runs from the xiphoid process until pubic symphysis. So that line is called as the linea alba. It's a white tendinous line. So, and also you have the inguinal ligament. You have the inguinal ligament which runs from the anterior superior iliac spine until the pubic tubercle. You have the ligament which is called as the inguinal ligament, right? So you have the inguinal ligament. So now coming to the boundaries which comprises the anterior abdominal wall, it's going to be the xiphoid process, the costal margin 7 to 10, and anterior superior iliac spine, you have the pubic crest, the pubic tubercle, the pubic symphysis. So the surface is comprised of the linea alba, you have the umbilicus, and you have the inguinal ligament. So now we'll study about the structures of the layers of the anterior abdominal wall, right? So study about the structures of the layers which comprises anterior abdominal wall. Alright, so the first structure or the first layer is always going to be the skin, right? The skin is going to be the first layer, and the second layer you have the fascia, right? You have fascia. We usually have superficial fascia as well as the deep fascia, but when coming to the anterior abdomen, we don't have the deep fascia. It's because we have got the peritoneal organs and you have the intestines. So in order to provide more space, for the organs, and in order to provide more protection, we don't have the deep fascia in our abdomen. So you have only the superficial fascia. So the superficial fascia has two layers. The one fatty layer, alright, and then you have a membranous layer. So the fatty layer is called as the Camper's fascia, and the membranous layer is called as the Scarpa's fascia. Alright, and then comes the muscles. The muscles of the anterior abdominal wall. You have the external oblique, the oblique muscles of the abdomen. You have the external oblique muscles, and you have the internal oblique muscle. You have the transverse abdominis muscle, right? So you have three muscles: the external oblique, internal oblique, as well as transverse abdominis. These are the oblique muscles we have. So the peculiarity about these muscles is the external oblique muscle, it runs medially downwards. So it runs, so considering this as the sternum, right, the umbilicus, and you have the pelvic girdle here. So considering this as the anterior abdominal wall, you have the external oblique running downwards medially. So it runs downwards medially, right? So it runs downwards and medially. And the internal oblique muscle, it actually runs upwards and medially. So the internal oblique runs upwards medially. And coming to the transverse abdominis muscle, it runs horizontally. Alright? So it runs horizontally. Right, the reason these muscles run, or like the muscles are made up in this arrangement, is because we have the organs. So in order to provide more protection to the organs, and in order to in order to prevent hernia, the muscles are arranged in a case that it provides more protection. So the external oblique muscle runs downwards and medially, the internal oblique runs upwards and medially, the transverse abdominis runs horizontally. Alright, and then comes the transversalis fascia. Right, and then you have the extraperitoneal fat, and then you have the parietal peritoneum, so these are the layers of the anterior abdominal wall. So you have the skin, and you have the fascia, you have the oblique muscles, and you have the vertical muscles, right? So vertically you have two muscles which comprises the anterior abdominal wall. So vertically you have the rectus abdominis, right, which is nothing but we call it as a six-pack muscles, right? So that is called as the rectus abdominis muscle, and you have pyramidalis muscle, right? So you have the external oblique muscles, and you have the oblique muscles, and you have the rectus abdominis and pyramidalis muscle. Alright, and you also got to know that each of these muscles continue with the aponeurosis. They end as aponeurosis. The aponeurosis is nothing but the continuation of each muscle, which ends up as a white connective tissue. The aponeurosis is nothing but the white connective tissue which continues as the muscle in order to join two muscles. Alright, for example, the muscles are joined to the bone by a tendon. So in a way, the muscles are connected by aponeurosis. So you have aponeurosis. So it's nothing but white connective tissue which arises as the continuation of the muscles. The continuation of the muscles is nothing but the aponeurosis. So all these aponeurosis, you have the aponeurosis of the external oblique, you have the aponeurosis of internal oblique, and you have the aponeurosis of transverse abdominis muscle. So all these aponeurosis join together to form a sheath called as the rectus sheath. So this aponeurosis together form a sheath called as the rectus sheath. Alright, the rectus sheath. And also there's a tendon called as the conjoint tendon. You have a conjoint tendon which is formed by the aponeurosis of, you have conjoint tendon which is formed by the aponeurosis of internal oblique muscle as well as transverse abdominis. So the aponeurosis of transverse abdominis as well as the internal oblique join together to form conjoint tendon, and all the aponeurosis of all the muscles join together to form a sheath called as the rectus sheath. Alright. So we studied about the structures which comprises the anterior abdominal wall. Now we will study about the vessels, the blood vessels which supply the anterior abdominal wall, the arteries and veins. Alright. So the arteries and veins of the anterior abdominal wall. Alright. So as we know already, there are two types of veins which supply blood. These are the superficial veins as well as the deep veins. And coming to the arteries, you have the superficial arteries as well as the deep artery. Right. So coming to the superficial artery, you have superficial epigastric artery and you have superficial external pudendal artery and you have superficial circumflex iliac artery. Alright, as we know, these three arteries are the branches of femoral artery. Right, so these are the superficial arteries which supply the anterior abdominal wall. So coming to the superficial veins, you have the lateral thoracic vein, you have superficial epigastric vein, and you have para-umbilical veins draining the blood from the anterior abdominal wall. Alright, so now coming to the deep arteries supplying blood to the anterior abdominal wall, you have superior epigastric artery, so here you have the superficial epigastric artery and here you have superior epigastric artery, and you have the musculophrenic artery. Phrenic is the Latin name for diaphragm. So you have the superior epigastric artery, you have the musculophrenic artery, and you have inferior epigastric artery. Alright, and you have deep circumflex iliac artery, you have the lumbar arteries, and you have the posterior intercostal arteries. Alright, So these are the deep arteries which supply blood to the anterior abdominal wall. Alright, and then coming to the deep veins which drains the blood. So as we know already, the superficial arteries and superficial veins have different names, but the deep veins and the deep arteries always have the same names. The deep veins have the same names as the deep arteries. So same way you have the superficial epigastric vein and musculophrenic vein. So you have superficial epigastric vein, you have musculophrenic vein, and you have the inferior epigastric vein, and you have the deep circumflex iliac vein, and you have the lumbar veins and the posterior intercostal veins. So these are the arteries and the veins of the anterior abdominal wall. Alright. So we have the superficial veins as well as the deep veins, and you have the superficial artery and the deep artery. Now we'll study about the nerve supply of the anterior abdominal wall. So you have the nerve supply, you have the lower 6 thoracic nerves supplying the anterior abdominal wall, the lower 6 thoracic nerves at the level of T7 to T12. Alright, and you have the iliohypogastric and ilioinguinal nerves at the level of L1 supplying the anterior abdominal wall. So I hope you guys are clear about the anatomy of the anterior abdominal wall, its boundaries, the layers of the anterior abdominal wall, the blood vessels, the arteries, veins, and the nerve supply. Thank you so much for your time. I will give you a heads up on the next video. Thank you.